It's important that pregnant women have the vaccine because this is the most powerful tool that we have in combating COVID-19 and preventing bad things from happening that we know are more common, especially in pregnancy when the body is naturally immunosuppressed. The choices that you make while you're pregnant are choices that cannot be made any other time. They are important because they are protecting a woman who is already naturally immunosuppressed and a baby that has no immune system that's developed hardly. And so it's dual purpose. There is no data right now to support that early vaccination, specifically in the first trimester, increases the risk of any harm, such as malformations or miscarriage. There are some groups that are avoiding first trimester vaccination, and that would be at most of what I would consider an understandable delay in vaccination. But our professional societies are clear that women who are pregnant should be encouraged to be vaccinated regardless of the stage of pregnancy. One of the most beneficial aspects of vaccination during pregnancy is that you have a robust immune response right then and there to the virus. And there have been documented studies that antibodies to COVID-19 after a woman becomes vaccinated during pregnancy are detectable in the umbilical artery blood samples. So it is not only being effectively produced during pregnancy, but it's effectively being transmitted to a growing baby, which is the most important part. During pregnancy, it is absolutely safer to get the vaccine than to risk getting the COVID virus itself. I've mentioned to many people before that there are so many more women that have received the vaccine compared to women that have had the COVID virus. It is so much more well studied than a woman who actually gets the virus itself. I would not want my wife or my loved one to be in the situation of being that test of what happens long-term or short-term or long-term for somebody that becomes infected with the virus compared to what we know is already safe about the vaccine. The vaccine helps you by combating the virus in an effective way, even if it's not to fully ward off the virus. The severity of illness will be much less in degree, and resulting in a much healthier pregnancy, a pregnancy that is at much less of a risk of enduring any sort of traumatic outcome. We know that with the vaccine, there is true safety data associated with this, and there is true harm data associated with the virus itself. That's not a risk that I would want to take for myself or any of my loved ones. And I want, at the end of the day, to see a beautiful baby announcement. I want to see those chubby cheeks on the pictures, on the cards, on everything. I don't want to see anything else than that.